ARCRA USA cares about the health and well-being of your patients. As a healthcare provider taking care of persons living with diabetes and requiring insulin injections, quality safety pen needles and safe usage are critical to effectively manage their diabetes. This video will show you how to properly use AssureID Duo Pro safety pen needles and AssureID Pro safety pen needles to perform an insulin injection and ensure the safety of you and your patients. AssureID Duo Pro safety pen needles and AssureID Pro safety pen needles are disposable, sterile needles intended for use with a pen injector device for the subcutaneous injection of insulin. AssureID Duo Pro and Pro safety pen needles offer a high level of protection for healthcare workers and patients with a clear safety cover over the needle before injection to protect against accidental needle sticks and allows for easy viewing of priming drops to ensure safe operation and delivery. A front-end safety shield that covers the needle before and after injection and withdrawal from the body. A red indicator to show the safety shield is engaged and locked. A 5mm pen needle for a one-handed, no pinch-up injection providing lower risk of needle stick injuries for healthcare workers and a lower risk of intramuscular injection for patients. A large barrel for easy handling and attachment. The AssureID Duo Pro has an additional back-end safety shield for protection against accidental needle sticks after injection. And remember, single use only. AssureID Duo Pro and Pro safety pen needles may be used with most universal threading pen injector devices. The most common pen injector devices used are shown here and are compatible with our safety pen needles. This information is shown on the carton and package insert. To ensure safe usage for your patient and yourself as a caregiver, please familiarize yourself with the precautions listed on the package insert. Performing an injection with AssureID Duo Pro or Pro safety pen needles. Always verify the patient's identity and confirm that you have the correct type of insulin and check its expiration date. Choose a healthy injection site. The recommended areas are the abdomen, thigh, back of arms, and buttocks. Rotate between injection areas. When you have selected an appropriate site, cleanse the skin. When the patient is ready, prepare the pen injector device for injection. Remove the pen cap and wipe the rubber seal on the pen with an alcohol swab. To attach the needle to the pen injector device, remove the seal from the safety pen needle by carefully peeling back the seal and discarding. For your safety, once the seal is removed, do not place fingers on the back end of the needle to avoid a needle stick. Gently push the pen injector device against the back end of the safety pen needle and twist clockwise. Note that the Duo Pro has a back end safety shield and the Pro does not. You are now ready to prime according to the pen injector device instructions. It is important to note that you can clearly see the priming drops through the needle safety shield to ensure your pen injector is working properly. When you are by the patient and ready to inject, remove the clear prime safety cover and set it aside to use when removing the needle from the pen injector device. Next, inject into the skin as recommended with or without a skin pinch-up. Most patients do not require a pinch-up with a 5mm needle. Insert the needle in one continuous motion. Hold the injection for 5 to 10 seconds before withdrawing from the injection site as recommended by the insulin manufacturer to ensure delivery of the full dose and to prevent leakage of medication. When injection is complete, remove the needle from the injection site by lifting straight up from the patient's skin. The patient end safety shield is activated automatically when the needle is withdrawn from the skin. Do not remove at an angle. For your safety, the automatic patient end safety shield will engage and cover the needle completely when you lift the pen injector device from the patient's skin. You will see a red indicator which signals the safety shield has been activated. Do not grasp or twist on the colored patient end safety shield or the white barrel of the safety pen needle at any time to prevent damage to the safety mechanism and to prevent a needle stick. To remove the Assure ID Duo Pro or Pro Safety Pen Needle from the pen injector device, first, attach the clear safety cover securely over the needle by pushing the cover over the purple safety shield and white barrel. Do not remove the needle from the pen injector device without first attaching the clear safety cover. Next, twist either the pen injector device or the safety pen needle counterclockwise to remove needle from pen injector device. For your safety, when using a Duo Pro safety pen needle, the pen connection end safety shield will automatically engage when needle is removed from the pen injector device to assist in needle stick prevention. Immediately dispose of the used safety pen needle in an approved Sharps container and according to your Sharps safety protocol. For your safety, do not grasp the needle by the back end to prevent a needle stick. Thank you for your attention to learn how to properly use the Assure ID Duo Pro and Pro Safety Pen Needle from Arcray. Please address all questions to our customer service team. For technical assistance, contact customer service 800-818-8877, 8 a.m. to 6 p.m. Central Time, or visit arcrayusa.com.